You notice your middle has changed. Then your feed gives it a name: cortisol belly. Suddenly the question feels more serious. Is this ordinary belly fat, bloating, stress, hormones, or a warning sign that something is wrong? That phrase is powerful because it connects many familiar problems: belly fat, a puffy face, cravings, poor sleep, and stalled weight loss. But it also smuggles in a conclusion. It makes one hormone sound like the answer before we have worked out the problem. The careful answer is not that cortisol is irrelevant. It is not that social media is always wrong. The careful answer is that cortisol belly is a doorway, not a diagnosis. So the question is simple. Does your belly prove high cortisol, or is the internet bundling several different body changes into one easy story? First, the word belly can mean different things. Subcutaneous fat sits just under the skin. You can pinch it. Visceral fat sits deeper around the organs. That is the type most strongly linked with cardiometabolic risk. Bloating is different again. It can come from gas or water retention. It may change within hours. Body fat usually changes slowly. If those experiences share one label, people can start blaming the wrong thing. Waist measurement helps because it looks past the label. A larger waist often reflects more deep abdominal fat. BMI can miss this because it compares weight with height, not where fat sits. That is why someone can have a normal BMI and still carry hidden metabolic risk. The question is not just how much weight, it is where the body is storing it. Now cortisol enters the story. Cortisol is not a villain. Your body needs it for energy, blood sugar, and alertness. Adrenaline reacts first when there is pressure. Cortisol follows, keeping the system awake for longer. Short bursts are normal. The concern is prolonged elevation. Long-running stress can disturb sleep, appetite, blood sugar regulation, and food choices. That is where the trend has a real biological hook. Stress can shift eating towards reward-driven, energy-dense foods. Under pressure, many people eat later, snack more, or reach for foods that give quick comfort. That matters for energy balance, even when the cause feels emotional. Stress can also interact with visceral fat. Deep abdominal fat is metabolically active, and chronic stress has been linked with patterns of central fat storage. So it would be too neat to say stress has nothing to do with the waist. But this is not the same as saying every soft middle is high cortisol. A mechanism can be real without being the whole explanation. The claim breaks when the body shape becomes the test. Many people with abdominal fat have normal cortisol levels. Their waist pattern may reflect age, genetics, activity, diet, medication, sleep, insulin sensitivity, or ordinary fat distribution. Energy balance still matters over time. Fat changes when energy intake and energy use do not match. Roughly 3,500 calories equal about 1 pound of body fat. That number is imperfect in real life, but it keeps one thing clear: fat loss is not a hormone switch. You also cannot choose where fat leaves first. Lowering stress may support better habits and health, but it will not target belly fat like a spotlight. Individual response adds another layer. In supervised exercise studies, weight loss varies widely. Some people move less later or eat more without noticing. That does not mean exercise fails. It means the body adapts. Genes matter too. Twin studies show large differences in how bodies respond to overfeeding. Set point ideas are not a free pass, but they do challenge the idea that every body change is a simple choice or a single hormone. True cortisol disease exists. Cushing's syndrome can reshape the body, but it is rare, around 10 to 15 people per million each year. It usually comes with clearer signs than belly fat alone. Warning signs include rapid central weight gain, a rounder face, purple stretch marks, easy bruising, muscle weakness, or steroid medication use. Those are reasons to seek medical review. A social media label is not. For many people, the more useful trail starts with sleep. Short sleep lowers leptin, the fullness signal, and raises ghrelin, the hunger signal. The next day, hunger can feel louder before willpower even enters the room. Sleep loss also affects glucose tolerance. That means the body handles blood sugar less well. Even partial sleep restriction can push this system in the wrong direction. Then caffeine often steps in. Some people clear caffeine quickly, others are more sensitive, partly because of genes such as CYP1A2 and ADORA2A. Late caffeine can keep the loop going into the next night. This is why a person can feel stuck even when they are trying. Stress, tiredness, appetite, caffeine and later eating can form a loop that looks like a hormone mystery from the outside. Before chasing a cortisol test, start with the checks that match the problem. Waist circumference gives a practical reading of central fat. Waist-to-hip ratio adds context about distribution. BMI can still be useful at population level, but it cannot see muscle, fat location, or body composition. Body fat percentage can help, but home scales and calipers are not perfect, and scans are expensive. These measures do not tell the whole story, but they tell more than guessing from a hashtag. They turn the question from, what label do I have, into, what is actually changing? If red flags are present, the answer is not another video, supplement, or routine. It is clinical assessment. Testing makes sense when symptoms point towards a medical reason, not when a trend makes a normal worry feel diagnostic. For most people, the reliable levers are less dramatic than the trend. Regular movement reduces deep abdominal fat, even without large weight loss. The broad target is roughly 150 to 300 minutes of activity each week. Everyday movement matters as well. Steps, chores, walking, fidgeting, and standing are part of NEAT. Non-exercise activity thermogenesis. It varies a lot between people, and it can quietly change daily energy use. Strength training helps protect muscle while fat is lost. That matters because muscle supports function and long-term metabolism. The goal is not punishment. It is a body that keeps more useful tissue. Recovery still matters. Hard training raises stress hormones for a reason. That is not automatically bad. But too much intensity with too little recovery can become another form of strain. Food quality matters because it changes fullness, energy intake, and consistency. The evidence does not require perfect rules. It points towards regular meals, enough protein and fiber, and fewer easy calories that slip in when life is stressful. Stress care is useful too, but not as a belly-melting trick. Breathing, meditation, time outdoors, and good company may help the nervous system settle. They support the conditions where better choices become easier. Be cautious with cortisol supplements and detox claims. Supplements are loosely regulated. Some cause side effects like bloating, and there is no strong evidence that cortisol-blocking products drive everyday weight loss. If someone uses supplements, third-party testing, such as NSF certification, matters. So, is cortisol belly real? As a phrase, it points towards real experiences. Stress can matter, sleep can matter, visceral fat matters, but the phrase is too blunt to explain the body by itself. The better question is not, do I have cortisol belly? It is this, am I looking at fat, bloating, sleep disruption, stress eating, fat distribution, or a medical red flag? That map is less viral, but it is more useful. It lets you take the concern seriously without letting a trend turn your body into a diagnosis. For the full article and supporting references, use the link in the description. BeSund.